Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the basics of kyphoplasty for vertebral compression fractures. Over 700,000 vertebral compression fractures occur every year in the U.S. Most of these are due to osteoporosis, and a lot of them are unnoticed because they don't have any pain associated. Half of women and 25% of men will have an osteoporotic fracture in his or her lifetime. And once a vertebral compression fracture occurs, the risk of additional fractures in the adjacent vertebrae goes up fivefold. The symptoms of a compression fracture usually includes a sudden onset of low back or mid back pain, depending on where it is. It usually gets worse while standing or walking. Limited spinal mobility due to the pain, height loss, deformity, and or disability. And if you have multiple fractures that lose height, like you see here, you can end up having a bent forward stance. That's called kyphosis. Here's the downward spiral. You start to get spinal fractures, you get back pain, then deformity, such as, like I mentioned, where you're leaning forward because loss of height. You start to pinch on the lungs, so you lose capacity. You lose the appetite because it pinches on the stomach. Problems with sleeping, less activity, which actually makes the osteoporosis worse, which increases the fracture risk. And then it goes on, and 23% increased mortality. So treatment options for a compression fracture, if the pain's not too bad, you can actually, it's called benign neglect. You can watch it and see if it gets better. Medication management includes over-the-counter pain medications, narcotics, or possibly some muscle relaxers, and then spinal bracing. So this brace is called a Jewett brace, and it has 3 points of compression, down here, up here, and in the back, okay, and it can provide exceptional pain relief. There's also a TLSO brace that covers basically the whole torso. Now, the vertebroplasty procedure was invented in the 80s for treating cancer fractures, and that began usage in 1990s for regular osteoporotic fractures because it works so well. Vertebroplasty is an outpatient low-risk procedure that provides instant pain relief, and essentially the catheter is put through this bone, called the pedicle, into the fracture, and cement is injected. Okay. The kyphoplasty procedure is an evolution of the vertebroplasty procedure. It was FDA cleared in 1998, but it really increased in popularity about 5 years later. So it is similar to a vertebroplasty as it uses bone cement, which hardens quickly in the fracture, but the difference is that it involves a inflation of a balloon first. So here's how the treatment works. The catheter is inserted through this bone called the pedicle into the fracture, and a lot of times it's done on the right and the left. Okay. Then the pain doctor will inflate this balloon with saline that will also have some X-ray dye in it so you can actually see it. All right. And once the cavity is created, the balloon is deflated and removed, and then under low pressure cement is injected to fill that, and then it hardens within about 20 minutes. Well, what are the outcomes? Typically it's immediate pain relief. Aches and spasms may continue for weeks, but usually that goes away. But most pain, over 90% of patients see dramatic pain relief right away, and they get increased function, including walking and performing activities of daily living. There have been a lot of studies showing this. There have been some studies showing questionable benefit, but they are far outnumbered by the ones who show incredible relief. The top pain management in Texas is through the Texas Pain Network. This includes several clinics throughout the state accepting over 50 insurances, and over 25 treatment options are offered. Over 90% success rates on average are seen with the board-certified award-winning doctors. Visit us online at texaspainnetwork.net, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.